Okay. Hi, I'm Parker Spradley, and my topic that I'm researching in ISM this year is pulmonary and critical care medicine. And some stuff about me: I'm a junior at Frisco High School, and I'm involved in our school through varsity cross country, student council, National Honor Society, and National Art Honor Society. But the club that I'm probably the most involved in and that I'm an officer of is HOSA. I was the chairman of membership sophomore year, and then this year I'm the secretary. And then HOSA kind of really inspired my interest in my topic, because the way that I first became interested in the medical field is by taking medical terminology freshman year, because my plan originally was to pursue health science too, and to visit the hospitals and the Case Center to decide if I wanted to go into the medical field. But actually, once I competed in medical terminology for HOSA and went to the National Leadership Conference and listened to one of the keynote speakers there, who was Dr. Samson Davis, it made me actually want to do ISM instead, because I wanted to research a more specialized field of medicine. And then some things about Dr. Samson Davis. He was the fifth of 6 children in one of New Jersey's poorest inner city districts. Nobody really thought that he would be able to become he's a very accomplished ER physician. Nobody really thought that he would be able to accomplish all that he has. He grew up surrounded by crime, broken families, and drugs. And then what really kind of turned him around was that he met 2 of his other friends, and they kind of made a pact, because they wanted to become more than people who grew up where they lived normally would. So it was from that support that he was able to do that. And then this reminds me of HOSA, because everybody kind of supports each other, because we all have the same goal of going into the medical field. So after I listened to his speech, I mentioned him on Twitter. I told him about what a great speaker he was, and then he retweeted my tweet, so I included that on my slideshow. I said one of the things he said was the cure to cancer is sitting in this room, and I found that really inspiring. So then he retweeted that and said it was a great time. So my quote for ISM is, "Be the change that you want to see in the world." The reason that I'm actually interested in medicine is because I want to have the ability to be able to save a life. It seems like simple because it's only one thing, but it has a huge impact. And I read this book by Mitch Albom. It's called For One More Day. And it's about somebody what they would do basically if they could have one more day with their mother. And it's really inspiring, because he would do just anything for that one more day. And I just really want to be able to give him something like that one more day. What is pulmonary and critical care medicine? I originally was going to study pulmonology as my topic, but then after going on interviews, I realized that pulmonology and critical care medicine are actually integrated. Pulmonary and critical care medicine is different from outpatient pulmonology, or working in kind of a clinic. Like if you go to a pediatrician, that's sort of like an outpatient clinic where you would visit a doctor for a cold. A pediatric pulmonologist would probably get cases like asthma and bronchitis and pneumonia. And then critical care medicine is actually very different. It's a branch of medicine concerned with the diagnosis and treatment of life-threatening conditions, which is usually multi-system, so a lot of your organs are affected by what was originally one cause. And it's a little bit more complicated than pulmonology, in that you have to kind of have a system-by-system approach and treat every organ individually. And then pulmonologists are the specialty that works in critical care medicine usually, because most of the patients that are in the ICU or intensive care unit have to be on a mechanical ventilator because they're unable to breathe on their own. Patient profiles in the ICU or intensive care unit are very diverse, so you're not seeing just all male or all female or all young children or all old. It can just be anybody. So I've been on 5 interviews for ISM. 4 out of 5 of them were at Parkland Hospital, and then 4 out of 5 of the people that I interviewed are their faculty members at UT Southwestern Medical Center, which Parkland Hospital is the teaching hospital for UT Southwestern. In Parkland Hospital, I'll talk a little bit about that because it's a really interesting hospital. It was founded in 1894. An interesting fact about Parkland is that John F. Kennedy was actually, when he was shot, he was treated at Parkland and pronounced dead at Parkland in 1963, so it's famous for that. It also provides the most uncompensated patient care, so the patients are not paying and they don't have medical insurance. It provides $1.5 billion of uncompensated patient care every year, which I think is interesting. It is, all specialties are represented in Parkland because it is so big, so that's why there are a lot of pulmonologists there, because that's usually an uncommon specialty. Okay, so my first interview was Dr. Lance Terada. He is a pulmonologist and professor chief of pulmonary and critical care medicine at UT Southwestern. He is actually, he said that about 1% of pulmonologists do what he does because he has kind of moved away from clinical and critical care duties to working in campus administration offices and conducting more medical research and grant research related to cell and molecular biology. And then I asked him about if he would have done MD PhD, which is like a combination of medical degree and research degree because he does research now. And he said that he would not recommend this because many people who actually pursue this program become so focused on academics that they become uninterested in doing any research after they have their PhD and actually go back to clinical medicine. So he doesn't recommend that program. Another interesting thing that he told me about Parkland was that a third of the patients that they see there are actually Spanish speakers, which is interesting to me because I'm an AP Spanish 4 and I'm trying to learn Spanish, and that just really conveyed to me the importance of continuing to do that. My second interview that I had was actually an internist, so he's a general practitioner. The reason I wanted to interview an internist is because before you become a pulmonologist, you have to become an internist. And then he was Dr. Ramesh Chandran. If he looks like Pranav, it's because it's Pranav's dad. And I asked Pranav if I can interview his dad because he told me that he worked in internal medicine, but he's an internist at the Dallas Veterinary Assistant Hospital. So he works with veterans. And then he said that 2/3 of internists pursue more specialized fields because he said, he was very honest, he said they feel like they're undercompensated. But the reason that he has continued to practice internal medicine rather than going into a more specialized field is because he really understands the importance of developing good patient rapport and relationships with his patients. And then he says that if you're a primary care physician, you have more of that opportunity to cumulatively build up on relationships with your patients. And another thing about primary care physicians is that they can actually turn patients away and decide that they don't want to treat them anymore. My third interview, this is my last interview that I had, was with Dr. James Finklia, and he is a pulmonology specialist. He also works at UT Southwestern Medical Center. He told me that he was inspired to pursue medicine after his own ICU experience. So he was actually in the intensive care unit. When he originally went to college, he was majoring in health science because he had planned to be a baseball coach at high school. But he got hit in the head with a baseball and he had some intracranial bleeding, so he had to go to the ICU for that. And then he said that once he got out of it, that kind of inspired him to pursue something more than being a high school baseball coach. And he told me he was inspired by somebody who was taking anatomy and physiology in college and kept telling him about how interesting it was. So he specializes in the care of cystic fibrosis patients as well as general pulmonology patients in the ICU. And then when I told him about my original work, which I'll get into that more later, but it's about investigating the causes of patient delirium in the ICU, he told me about the keynote speaker for his pulmonology fellowship at Emory College, and it was Dr. Cheryl Massac. And she had some really interesting experiences with the ICU, where she thought that the physicians were actually trying to rape her every time they would lift up her gown. And I thought it was really interesting because I'm trying to learn more about the causes of delirium for my original work. Okay, my other interviews was Dr. Catherine Chen. She was my second interview. She's also a pulmonologist. She works at Parkland, and she's an assistant professor of pulmonary and critical care medicine. And then Dr. Matthew Leveno, he taught me a lot about the ICU, and he's a pulmonologist and director of the Parkland Medical Intensive Care Unit. This is about the intensive care unit. I learned a lot about this in my research assessments for ISM. It's the most costly component of hospitals because it requires the most expensive equipment. They have a lot of life support equipment, and it also has the most intensive care because the patients are in such critical condition. And then what's interesting is that despite being the most expensive department, it has the highest mortality rate of any hospital unit, which is around 20%. And then the most common reason for entry into the ICU is respiratory failure and the need for a mechanical ventilator. And then patient mortality is, even though they're usually on a ventilator, it's most often attributable to non-pulmonary injury, which is other organ systems or, like I mentioned earlier, delirium. Okay, ICU psychosis. For my original work, I wanted to investigate the causes of ICU psychosis, which is the onset of delirium in mechanically ventilated patients in the ICU, which is really prevalent in the ICU. It affects approximately 80% of patients. And then delirium, I didn't explain what that is. It's basically defined as a disturbance in cognitive function. So this is a really big problem. It affects a significant majority. And there have been a lot of studies showing the correlation between the onset of delirium and increased mortality rates. The one that I read said it would be a 6-fold increase in mortality and a 2-fold increase in hospital stay. But I have yet to find anything that kind of explores the causes of delirium or how delirium is directly related to mortality. So I plan on investigating that for my original work. And then I'm hoping that by exploring kind of the psychological side of ICU psychosis, that I can kind of explore a neglected field of medicine and kind of improve the experience for patients in the ICU and their families. Okay, thank you.